Tonight, we're focusing on the system or lack of systems in Oregon's most populated county for dealing with mental health. It's an urgent crisis in many parts of our state, but you see mental illness in many of the people living on the streets of Portland and in Multnomah County. And tonight, we're taking a deep dive with a medical doctor who's also a county politician and who has some definite ideas on what's wrong and how it should be fixed. That's our big story tonight. Multnomah County Commissioner Sharon Meieran is a lawyer and a medical doctor and a politician, so there's a lot of brain power there. When she steps forward to dissect the way that Multnomah County is and is not helping those with addictions and mental illness, well, we think it's worth paying attention. I had the chance to sit down with her late last week to talk about her request to Governor Tina Kotek to bring in state resources to help untangle Multnomah County's mess.
I've sent out a desperate call for help. So just taking a step back, counties, under the structure we have now in our state, counties are the local mental health authorities. There's kind of local control over what we do with mental health and addiction.
As opposed to some states where it's top down from the state.
Exactly.
And it's all congruent throughout the state because of that.
Exactly. Exactly, and Massachusetts is a great example of that.
Yeah. But in Oregon, every county can run it a little differently if they see that as being the best way.
Yep. And I personally think that that's a great approach. I believe in local control, actually, over these sorts of things, so long as there's some centralization and someone overseeing all of these with a larger plan to ensure they fit together. So we need both of those things, leadership at the state and coordination and functioning counties that are able to make the systems work. And for many years, we've had neither. I mean, we've had neither for longer than many people can remember, or as long as. So for decades, there hasn't been a prioritization or investment at the state level. There's been deinstitutionalization with the belief that we should invest in our local communities. That's where we should be providing mental health services. And if we do that, people will not need that kind of institutionalization.
Which is a great talking point.
Great talking point, and probably true. The problem is that there was not the community investment, so communities were starved of the ability to provide mental health services, and places like, say, Multnomah County, we didn't do it right even with the money we did have. So it's a combination. If we had systems that function in our local communities and deinstitutionalization, but the investment in the local, we could have our system could work. It is possible. We've seen examples where it works, but Oregon in general has had such horrible behavioral health leadership. Behavioral health is addictions and mental illness. You hear that term. A lot of people don't know what it is, but under Kate Brown's leadership at the Oregon Health Authority, I've called it verging on the criminal incompetence. So there's no leadership at the state for many years, but that's not an excuse for the counties, who are the local mental health authorities, to not do their jobs.
By the way, if you don't know, Kate Brown was the governor during the time Commissioner Meieran is referring to, and I'm sure that she would no doubt disagree with the characterization. Brown did tell me during our exit interview when she was done being governor that while deinstitutionalization did happen, it is correct that state money did not go to help the local communities at the same time, although that did happen before she was governor. All right, back to Sharon Meieran. She said that some counties in Oregon are actually running their local mental health authority with great skill. She pointed to Washington and Clackamas and Lane counties, each as examples of how behavioral health can be coordinated and done right. She thought her experience in the ER would help guide Multnomah County.
And so I thought, having seen this and where we could potentially intervene, the county's the local mental health authority. I'll go use that expertise there. And then got to the county, goes back to a little of what we were talking about earlier, and recognizing, oh my gosh, there's not a system in place at all. Like, what are we doing? And so that's when I started work to do the gaps, sort of the gaps analysis, but deeper than that, about how our system functions, what we don't have, what we need. Hired an organization outside of Multnomah County to do it, and they made great recommendations, and the next step of that was to create a plan based on this 70-ish recommendations, some big, some small. I mean, they said biggest one is there's no system, like there's no shared vision, there's no shared understanding, and so got a group together of leaders in the community and peers, people with lived experience, and said, okay, these are people I've known from working for over a decade in the system itself and as an advocate. These people are doers, and we can change the system. So let's create this, what a system should look like. Had a catchy name. It was Blueprint for Better Behavioral Health. Analyze, align, and act. All that. Alliteration. And the goal was action, because all of us have sat on more committees and task forces than you can even think about. So we were doing that work, created actually even the matrix of how, like, prioritizing things, putting them together, creating the plan Multnomah County is required to have. And then, COVID hit. And then some other work started, and the chair decided not to support that work anymore.
Support your work.
My work. Not support my work. And it all shifted.
Now, during that time, the county chair was Deborah Kafori, but after her term was over, she left office. And in the November 2022 general election, Jessica Vega Peterson beat Sharon Meieran in the race for county chair by nearly 27,000 votes.
With a new chair, I was hopeful that we could actually sort of pick that up, because we're term limited. I have 2 years left on the board to be able, now 1 year, to be able to work on those mental health systems. And she was not interested. And I've provided the information, the background, the people involved, who are all people that are involved in this work, the state level leaders. And she said that she would be coming up with a strategic plan around behavioral health. Unfortunately, that has not come to pass. We've had turnover. I think now it's been, since she's been there for a year, 3 behavioral health leaders. There's been no prioritization of hiring we still don't have a behavioral health director for the local mental health authority. There has been no prioritization of that. It's one of the biggest crises facing our county, affecting everything we do, homelessness, all of it. And we don't even have leadership. I don't even know where to go to ask a question about behavioral health in the county. And I used to be very tied into the people doing the work. I've been on different task forces, committees, because they're all, saying, oh, we don't have a thing. And they come up with, let's put in a shelter, let's put in a treatment center here. Let's do this 16-bed thing there. Let's invest in this one shiny object. No one's putting the pieces together into a plan, and we see the fallout, and it's killing people, and it's harming people, and it's kids, it's elders, it's people living outside, it's people living inside, it's everyone. And I think what forced it, I tried last year, we had a new leader, I'm like, okay, we can get this together, and saw complete abdication of responsibility for this. And it's only gotten worse. Fentanyl crisis, thought it was a crisis. Thought we're doing it's an emergency. Not sure what we're doing there.
Now, as a county commissioner, Sharon Meieran has actually surprisingly little power compared to the county chair for Multnomah County. But one thing she can do is use her position to shine a bright light on areas that she thinks you need to know about. And that's what she's doing here.
It's just, it's too much. It is failed. The county, Multnomah County right now, does not have the ability to get its act together, create a plan, and implement it. It doesn't have the relationships or trust in the community of leaders. It is not able to do that. And given that the local mental health authority responsibility is based in statute, and it's a state mandated allocation of authority, it's like I went to the governor, and I know she cares, and I know her wife is deeply involved. She's actually a mental health care provider and is doing work herself. And I know she gets it. She's trying to do all the central city work and give attention to this area and this region. And I just said, this is the thing. Multnomah County needs to succeed for the state to succeed. Everywhere else, they're actually starting to get their acts together. Counties are doing great work. We need Multnomah County to work, and it's not going to happen just with the system we have. So I didn't ask the state to take it over, but I asked the state to intercede and figure out what's the fix.
All right, so what is the fix? I emailed the governor's office to ask what's happening with all that. They told me that actually the Oregon Health Authority responded to Commissioner Meieran, and they asked the OHA to answer my questions. But the OHA has not done that. Okay, so what do you think about Commissioner Meieran asking the state to step in and go in public with all her concerns here? Did anything she talked about during the interview surprise you? Let us know, will you? You could email us. The address is thestory@kgw.com, or call and leave a voicemail. The number is 503-226-5090.